Now, Organized Labour says it will embark on an indefinite strike from December 27, 2022. This was made known by the Secretary General of Trades Union Congress, Dr. Yao Ba, during a press briefing on Monday. He explained that the strike is due to government's decision to introduce a debt exchange program. According to him, the strike will be in force until the government exempts pension funds from the planned debt exchange program. Labour Union present at the briefing were the Ghana National Association of Teachers, the Ghana Medical Association, the University Teachers Association of Ghana, the Ghana Registered Nurses and Midwives Association of Ghana, and the Teachers and Educational Workers Union, TEWU.
You may recall that exactly 1 week ago, we said we were asking government to exempt us from the debt exchange program. We sent the letter and we told the whole world that if government doesn't do that, we will advise ourselves. Today we are here to tell you the advice we have given to ourselves. Yes. And that advice is very simple. We have decided, all of us together, that because government has refused until today, by midday of today, to grant us our request that all pension funds, and we are not exempting anything, all pension funds must be exempted from the domestic debt exchange program. We have decided firmly that all workers of Ghana are going to strike on the 27th of December, and we will be on strike until our demand has been granted. And the demand is simple, that all pension funds must be exempted from the debt exchange program. And what it means is that all workers of Ghana should stay at home on the 27th of this, starting from 27th. Don't go to work. Stay at home. And we will stay at home until we hear publicly that government has exempted all pension funds from the domestic exchange program. That is straightforward and very simple. Between now and 27th, we have a few days to Christmas. From tomorrow, in fact, we have started today, every worker in this country must signal to government and to their employers that we are not sitting down for our pension funds for the most vulnerable people in this country to suffer because somebody has made mistakes. We are going to be in our red band, red t-shirt until we hear on the 27th. And we are not meeting here again. 27th, if we haven't heard anything, we start a strike. If we hear anything positive, we organize another press conference and tell the whole world that the strike is over. But that is when the exemption has been announced.
Now, the minority in Parliament say farmers are set to face a crisis during the next planting season if government does not settle its indebtedness to suppliers. Government currently owes suppliers of fertilizer and improved seedlings several millions of cedis. Deputy Ranking Member on the Food and Agriculture Committee, Dr. Godfrey Seidu Jasau, says the suppliers are threatening to freeze supplies to farmers who desperately need them. He was speaking during the consideration of budget estimate for the Agric Ministry.
Mr. Speaker, as we speak, because of the challenges of arrears that the ministry is facing, non-availability of money, and therefore even the budget of 2.1 billion that is being allocated to the ministry now, almost 1 billion will be used to settle arrears if the money does come at all. Mr. Speaker, that is not a good impression for a ministry that we are supposed to rely on for production of the very food that we need to survive as a people. Mr. Speaker, even with this, if it comes I don't know how the next production season is going to pan out, because, Mr. Speaker, as we speaking to industry players, most suppliers of fertilizer and improved seeds that have been registered to supply these inputs for Planting for Food and Jobs programs have threatened not to supply for the next production year, because they have been owed money that they have not been paid. They have not been paid simply because the Ministry of Finance have not released money to the Ministry of Agriculture to be able to settle this indebtedness. Mr. Speaker, that said, it means that our farmers are likely not to have the adequate supply of these inputs that we so require to prosecute the next production season. Mr. Speaker, if seed suppliers and fertilizer suppliers pull out, that means that we are likely to have a deficit, a big deficit in production that is likely to spell out food insecurity for this country, and that might be a crisis, and we have to look at it.
Dr. Godfred Seydou Jasau is Deputy Ranking Member on the Food and Agriculture Committee of Parliament. Let's head to Parliament now and speak to Parliamentary Affairs Correspondent Kweku Asante for details. Kweku, how did the Minister respond to these concerns from the MP?
So the Agric Minister, Dr. Owusu Akoto-Free, admits that his ministry has been facing some challenge in terms of getting the full complement of monies that have been approved by Parliament from the Finance Ministry. Indeed, it was the general overview of a number of ministers that the Finance Ministry were not able to raise enough revenue to be able to settle them in terms of all the arrears. But he said that this is a serious matter that the Finance Ministry was looking at releasing money as soon as practicable. He was then arguing that this is why the minority need to support tax measures like the VAT, the e-levy, so that government can raise enough revenue to pay these fertilizer suppliers and seed suppliers off. This has been such a big challenge. We know that just in September, the seed suppliers released a statement that government was owing them about 207 million, and that if government did not pay, they were not going to supply seeds to farmers. The fertilizers suppliers are also making the same demand. So this is a big issue that Parliament says the ministers must deal with urgently.
Well, what else will be happening in Parliament today?
So just gone by, leaders of Parliament held a meeting that was organized by the Ministry for Parliamentary Affairs. They've been discussing the role of Parliament in the development of the country. They've been talking about how Parliament can or should be blamed for the current economic challenges. Both the minority and majority leaders agree that Parliament ought to do more to check government's borrowing so that the country is not plunged into a debt crisis like it's facing currently. So that meeting has just ended. When we go back to the chamber, what is going to happen is a number of the key ministries are going to present their budget estimates that the Ministry of Finance allocated to them. Is going to be debated before it is passed. Parliament is expected to go on break, Christmas break, tomorrow. It is tomorrow that we expect that the VAT rate increase bill will come, the e-levy amendment bill will also come, and so tomorrow could be a contentious one. We could see the scenes that we saw during the approval of the e-levy, but today some ministries are going to get their budget estimates approved.
All right, Kweku, thank you so much for joining us with those updates there. Now let's go back to our earlier story where labor unions are declaring an indefinite strike beginning 27th of December 2022. We have Boachi Yadom for us to interrogate a bit on this. He is a labor consultant. Yadom, thank you so much for joining us. With where we are, government is at the IMF looking for a bailout. That has resulted in government deciding to bring a debt exchange program. Labor says we don't want you to touch our pension funds. How must government approach this development now to ensure that this breakdown that is staring at us does not come into effect?
Yeah, good morning, sir, and my greetings to the cherished listeners. And thanks for having me on your platform. I think the only medicine available to government in this particular instance is engagement. They should just invite the union and have a discussion with them. This is a matter that affects their members, and I think they have every right to fight for the welfare of their membership. So, in spite of the fact that it's a huge national discourse, the need to also subject yourself to, the technical application available is very, very important. And for me, I think discussing this matter with the workers' union is very important. So that is what I expect the government to do.
Warning earlier for government to engage. Government didn't, and that's why they have now declared this indefinite strike. Does it occur to you that government is willing to talk if it didn't do that after the earlier warning?
If the government fails to talk, the other alternative is not good for anybody. Okay, so I think that currently we don't have much choice. All that we have is to engage them. See, engaging them doesn't mean that you actually subject yourself to what they want. Engaging them means that you're going to explain the tenets of the system, whatever you want to do, the fundamentals, the principles, what motivated this situation, what you've done over the period. You bring all the salient issues to the fore. Then we can all look at it. The union will also consider it. They will also bring their issue. But, negotiation, the outcome of negotiation is always good when it's a win-win situation. So I don't expect that the government will come to the negotiating table with a very hard stance. Neither do I expect the unions to also come with a very hard stance. What the government will have to do is to find a way to break the ice,
Okay.
so that we will have the kind of atmosphere that will actually motivate the process. Then you can have a discussion. I'm telling you that if they engage the unions, both sides will have a very fruitful contribution, which will make it easier for the two sides to understand that at the end of the day, we all have to, we don't have to cherry pick, but we all have to come to the realization that the national interest is paramount.
But once government failed to negotiate, to even engage them at all, you understand these issues. What do you think is happening? Why is government not coming to the table? And how would you describe government's, non-responsiveness to their calls all this while?
I don't understand why government has failed to negotiate or discuss the issue up to now. I only consider that as being the government is being recalcitrant. Because you see, if you have an employee who is not happy with any matter at all, whether he is right or wrong, your responsibility as an employer is to engage him and explain why a certain action has been taken to which he or she is not happy. It's your responsibility as an employer. So why will government fail to engage? I personally don't understand. But the moment they gave you that notice that if you don't do this, we'll go on strike or we'll embark on industrial action from 7 days, it was a clear indication of an invitation to engage.
Yeah.
That notice was an invitation to engage. So I don't understand why we've not engaged up to now.
Okay. All right. I'm grateful to you, sir, for joining us. Yadom Boache Amponsa is a labor consultant there. Now, to other stories, the World Health Organization has ranked Ghana amongst a group of 29 countries, accounting for the highest number of malaria cases globally. In the latest World Malaria Report, the World Health Organization says there was a 2 million surge in malaria cases from 245 million in 2020, resulting in an estimated 247 million malaria cases in 2021 in 84 malaria endemic countries. The report stressed that 95% of the increase in cases are coming from Ghana and other countries in the African region. Dr. Dorothy Achu, team lead for tropical and vector-borne diseases in charge of World Health Organization African region, he gave a breakdown of the report. So the doctor
most affected, carrying the highest burden. But we have hopes, and the Director General of WHO, Dr. Tedros, mentioned this in the report by saying that although we face many challenges, and I quote, there are many reasons for hope by strengthening the response, understanding and mitigating the risks, building resilience, and accelerating research. There is every reason to dream of a malaria-free future. And I quote, many countries are already beginning to see their country eliminating malaria as a result of resilience to the situation. Looking at the African region, we notice that from the 247 million malaria cases that were registered globally, 234 million are in Africa. And again, we registered 593,000 deaths. These are enormous numbers. And if we look at it very keenly again, 80% of these are in children under 5 years of age. And this is compared to 91% in 2000. On the left hand, you can see that in 2021, there were 84 malaria endemic countries globally, covering several continents. But this global distribution of illness, of this disease, is masking real disparities among the countries. So the countries have different distributions of illness. And the pie chart, which you can see, shows us the disparities in the distribution of malaria burden. Summarily, although Africa is bearing the highest burden of disease, they are also making the highest efforts in averting cases and deaths. So let us focus a little bit on the high burden countries. We have 11 high burden countries, 10 in Africa and 1 in Asia, which is India. So these high burden countries, as we see, there were also increases in incidence, as we can expect. But we also noticed that even those high burden countries, there was a great reduction in the number of deaths. And the countries that really contributed in reducing the deaths were DRC, Ghana, India, Niger, and Tanzania.
My colleague Blessed Soga monitored the conference as the report was released, and joins me live on Zoom with more. Blessed, what more do we know of this report?
Well, Bray, so globally, the World Health Organization is reporting that there were an estimated 247 million malaria cases in 2021 alone in some 84 malaria endemic countries. And the indication we're getting is that this is about a surge of 2 million cases from what was recorded in 2020. So in 2020, actual number of cases were ranging somewhere around 245 million. That was the range for 2020, but it shot up to 247 million in terms of the number of cases in 2021. So what you have on the screens right now is a picture of the number of countries that are marked red, most of them in sub-Saharan Africa, accounting for the highest number of cases. What's significant is that the World Health Organization is indicating that the countries which are recording most of these high numbers are accounting for 95% of all of the 247 million malaria cases, which means that Ghana is amongst one of these 11 endemic countries, accounting for that surge in the figures that you see on the screens there. So that's our global position in terms of how we're doing. Beyond us as well, the World Health Organization is pointing out that we're having some deficiencies in terms of our surveillance. They are pointing out that we're not adopting some of the toolkits and digital frameworks that have been put up in terms of reporting cases. So as of 2021, 2022, it appears that the World Health Organization is flagging us for still relying on paperwork in terms of reporting when it comes to, tracking down our malaria cases. So these are some of the frameworks, issues pointed out in this document, which the belief is that authorities will be able to track down these cases and to, of course, scale up the response towards this. Beyond that as well, there's the issue about COVID-19 pandemic. The pandemic appears to have been causing some disruptions as well in what's happening in terms of our fight against malaria. But this appears to be a perennial problem for Ghana because, mind you, our cases were expected to have come down. But looking at what the trend is, the cases appear to be going up, except to say that for Ghana, we've been spared, if I could use that word, in terms of death rate. We've been able to reduce the number of deaths from malaria infections, and that's a plus that the World Health Organization is giving it.
Thank you very much, Blessed Suga, is my colleague here at JoyNews. Now, Dr. Kezia Maum is the manager of Ghana's Malaria Control Program, and she joins us live with more. Thank you very much, Doc Maum, for your time. Why are we still recording high cases of malaria after all these years of advocacy?
Thank you very much for having me, and good morning to your listeners. Yes, indeed, we are one of the 11 countries which accounts for the highest global malaria burden. But I just want to point out that from the report, we are one of the few countries that have been able to meet the target set for 2020. The few countries that have been able to reduce our morbidity and mortality in the region. So despite the fact that we are in the 11, there is progress. In fact, if you look at the previous report, we're contributing about 4% of the world burden. In the latest report, we are contributing about 2.2%. We still continue to observe high numbers. One, due to our climatic conditions. Two, due to the fact that we haven't been able to scale up optimally all the tools. Three, even with the scale up of the tools, there is the requirement of the behavior change for people to use these interventions for us to experience the maximum impact of these interventions. So there is progress, but there's still more work to do. And so even with the report, I'm quite happy that as a country, we are trying to be more ambitious and moving towards elimination. So it just shows that when we put our hands to the wheel, we will make some progress.
So, significant that we've jumped from 4% to some 2% in terms of our contribution to the whole prevalence. But would we say that is how much we have achieved over the 10 years in our fight against malaria, or there's more?
So when you're talking about 10 years, there's more. So this latest one was looking more at the global, whether we've achieved the global technical strategy, which was set in 2015. So we are talking about a 5-year progress. In terms of 10 years, if you take like 2010, I think we were recording at our health facilities, we were recording deaths in thousands. Last year, our deaths that we recorded for malaria was around 275. So when it comes to malaria deaths, I can say that we've reduced them by over 75%. We indeed still are grappled with high numbers of disease due to malaria, and that's where we need to work more. So we haven't been able to achieve that much as we have achieved with the deaths. So people are not dying from malaria as we used to see in the past, but people are still getting sick from malaria. So we haven't achieved 75% reduction for the disease, and there's still more work to be done for us to be able to do that.
So once there's more work to be done, what are we doing differently to change the narrative?
So what we intend to do, and I'm sure in the course of 2023, we will come up with a national malaria elimination strategy that would be publicized. We are working on it, but what we intend to do is to zone the country into areas with low transmission, medium transmission, high transmission. In addition to what we are already doing, we are going to enhance our surveillance, especially in the low transmission areas, and look for additional tools that WHO is coming up, innovative tools to drive down the transmission further, so that at least we can move the low transmission areas closer towards elimination, whilst we continue to scale up our interventions in the other areas. So we hope that in the course of 2023, usually likely to be around World Malaria Day, we would see a new strategy in our fight against malaria.
How would that entail digitalizing the effort? Because we had the World Health Organization mentioning that it looks like we are not using the digital platforms to report malaria cases. How will that be part of the new strategy?
So it will interest you to know that Ghana is one of the countries that's doing very well in terms of digitalization of our health data. In fact, all the health facilities through the districts and the regions report through an electronic health information system. What we haven't done nationwide is the transactional data, where every case when you come, it goes into the digital system and automatically goes into the bigger health information system. So what goes into the health information system is the aggregated data. But we've started quite a number of health facilities, quite a number of regions are now entering transactional data. Yes, it's not optimum. It's not at where we want to get to. But if you look at our progress over the years, we have really improved. And in fact, for malaria program, almost all the interventions that we do on the field, we do real-time digital data collection. When we are distributing nets, when we are doing giving drugs to children for seasonal malaria chemo prevention, right from the community volunteer is digitalized. So we don't do paper transactions for that. But Ghana is one of the countries in Africa that is far advanced in digitalizing our health information system. Transactional data is being digitalized. It's not everywhere in the country, but we've made a lot of progress. Okay. So with the low malaria transmission, in fact, all the health facilities in that region will be doing transactional data, because what will happen is once you get malaria, somebody reports to malaria, we need to know as quickly as possible so we can react to prevent further transmission of that malaria. So that will be one area that will strengthen even more in making sure that surveillance is more electronic and more real-time in the areas where we'll be having low malaria transmission.
With this whole distribution of net, some people take them, they don't use them. What has been our monitoring system in that regard, and how can we change it to ensure that probably, those who are taking it are in fact using them, or we are changing the strategy after all?
Yes, we have a challenge where people take the net. Some people take the net and don't use it. So if you look at our data, the last study we did in 2019, we had about 50% of people using the net, whilst the others don't use the net. We do monitor, we do continuous surveys. When we do ask pregnant women, when they come for antenatal, when people come to the health facility, especially if they come down with malaria, to try and find out whether they have the nets and they are using the nets. We also continue to use our BCC tools, working through the media. So when I say BCC, I mean communication tools, using the media to try and encourage people to sleep in the nets. But what we are doing is to put in other interventions. So in addition to the nets, we have what we call the larval source management, which is taking care of the mosquitoes in the baby form, even before they get to baby, they get to adults. The breeding sites of the mosquitoes, we try to destroy the mosquitoes within. And we hope that some new tools will be coming up. It's in the early stage yet, but to manage the outdoor transmission so that when people sit out for late, they know what to do to prevent being bitten by mosquitoes. But we continue to ask people, if you have the nets, when you go in, please sleep under them because they are effective.
Okay, thank you very much, Doc, for your time here. Now, Ghana will head into this Christmas season healthier and better prepared for COVID-19 since its outbreak in 2020. The Ghana Health Service says there are just 4 people with the virus in Ghana. All of them are without symptoms. Hospital beds are completely free. No one is currently in critical condition or receiving treatment for severe COVID-19. But the Ghana Health Service says we must, however, be vigilant as cases are rising in other countries, whilst tourists also prepare to arrive in Ghana. We'll hear from them shortly. First, how will the country fare as there are no mandatory protocols in place?
At the height of the COVID-19 outbreak in Ghana, President Akufo-Addo announced Ghana's first partial lockdown on Friday, March 27, 2020. At the time, Ghana had recorded 137 cases and 4 deaths. The lockdown, according to the president, was to help curb the spread of the virus. At the time, the number of passengers in public transport was reduced, nose mask wearing became mandatory, as well as social distancing at public gatherings. As cases began to surge, the president, in his third address to the nation, directed the closure of land, sea, and air borders to human traffic. By the end of 2020, schools were closed, churches had moved online, and funeral attendance was limited to 25 persons. Although this last restriction was mostly defied. As cases began to decline, the president, in his 28th address, announced a gradual lifting of the COVID-19 protocols. Borders as well as schools were reopened. Currently, the public has returned to full life as almost all restrictions have been lifted. According to data available to the Ghana Health Service, Ghana has a total of 171,023 confirmed cases, 9 active, and 1,461 deaths. But the question is, amid fears of a possible rise in cases after the festive season due to travels in and out of Ghana, can the current relaxed state of protocols help keep the numbers where they are?
So we can now hear from Director General of the Ghana Health Service, Dr. Patrick Kumar-Boakye, who is urging the public to observe the protocols.
So for Christmas season, we want to reinforce the response to the anticipated surge. And we are providing more reagents for testing. We are reviewing our logistics to ensure that we are ready as part of our capacity building and ongoing engagements with the religious organizations ongoing. So for key recommendations for churches, mosques, and other revenues, irrespective of their size, the use of air conditioning, otherwise, these are the recommendations as follows. Face masks by all worshippers is recommended. And persons using shared microphones, in particular, I encourage to ensure that they all mask all the time, especially when you are passing the mic from one person to another. It's important that such people wear their mask. Hand hygiene facilities should be available at such venues by the leaders and advised to encourage members to appropriately use such facilities. Sometimes it's there, nobody's using it. Social distancing, where practicable, should be practiced. And of course, we need to remind ourselves about the cough etiquette so that you don't transmit it to someone else. Nightclubs, given the closed nature of nightclubs and the high humidity in such venues, the spread is quite common. So in as much as possible, we follow through with these measures, such as maintaining social distancing, and then should be observed in those places. Club owners are encouraged to provide hygiene facilities, preferably alcohol, hand rubs, out these venues, and encourage patrons to use them. And patrons of these venues are advised to ensure that they are fully vaccinated against COVID-19, and also encourage people that please get vaccinated so that you can protect yourself. Whether it's vigil, concerts, watch night, crossover, we are encouraging that these large gatherings be held in the open, where ventilation is good and that the risk of transmission is significantly reduced. And persons who are unvaccinated should take advantage of the ongoing vaccination campaign to get vaccinated before attending such programs. And the churches can also be helpful in encouraging their people to take vaccination. Booster doses are also recommended. Those who have not taken their booster, they should make it a point to go and take their booster shots.
Now, the national chairman of the National Democratic Congress, so the general secretary of the NDC, Fifi Kwete, says he will hunt party members who have infiltrated and compromised the affairs of the party. He explained that his tenure will deal with what he describes as moles in the party. He was speaking on PM Express last night.
More than anyone, so the leadership is important, but the voice and the will of the team and supporters of the party and those who are sympathizing, who want to change, for example, will be the much more important thing. Now, if there is anybody who is even what you call a mole within, that person clearly is going to be in danger, because with the kind of leadership we have at the moment, if you are a mole, you are soon going to be in trouble. You definitely are going to be in trouble. So, to be honest, it's something I will not underplay. I will not think it's unimportant. But I will say that the collective will of those of us who want the right thing to be done and supported by the million of the supporters is going to make sure, even if you're an infiltrator for the MPP, you're going to be in trouble.
What you just said there must send shivers down the spine of moles in your party. You say you're going to be found out very soon because of the current crop you have.
Absolutely.
Absolutely.
I mean, my own belief is that with the suffering the people of Ghana are going through, I mean, I don't want to go into the details of the economy, but if you see this kind of massive suffering, the kind of suffering hardship that is going through, if you can still see all that, and because of your stomach, you decide to be a mole to stop the change that is absolutely important for the millions of people, you are going to have a lot of curses on you, and that curse is not even coming from me. Even the suffering of the people alone will be the curse that you carry, and that curse can actually affect you and affect generations to come. So if you are one of those, I think you better be thinking.
Now to other stories. And residents of Sisala East Municipality of the Upper West region are worried about the delay by government to fix deplorable roads in the municipality. Roads Minister Kwesi Amakwata last year promised to fix the roads in the area after residents protested the bad nature of roads there. Rafik Salam reports that 13 months after that promise, very little has changed in the township.
That I have come here and I've made this statement on behalf of His Excellency the President. Within the next few months, you will see what is going to happen to Tumu internal roads. And we are not only going to raise it to surface dressing. That will precede it. Tumu roads, after the initial surface dressing, will be raised to asphaltic level.
It's been over a year since Roads and Highways Minister Kwesi Amakwata gave this infamous assurance to the chiefs, youth leaders, and the people of the Sisala East Municipality. Very little has changed 30 months in the swinging Sisala East constituency. He openly bragged as their own.
So if you are building roads everywhere, that is how much more a place that is our own. And nobody should be, I'm not afraid to say it, I have the courage, this is our seat, and it will be done. You will get what you deserve.
President of the Sisala Youth Forum, Yusuf Napona, is deeply worried to the marrow about the failed promises.
We have not even seen one chipping that is laid in any part of Tumu town to talk about ash fighting. We have not seen any machine roll into Tumu town to talk of ash fighting. Yes, that promise was made. It was made in his presence. It was also made in the presence of one of the deputy ministers in that ministry. The chief directors were there. It was also made. And a good number of follow-ups. I have personally made follow-ups on that, but it has not been materialized yet. And no communication as we speak on that.
Roads and Highways Minister on his way to Tumu for the meeting in a convoy of dozens of vehicles suffered the inconveniences and pain drivers go through daily on the deplorable roads. One is Land Cruiser had a flat tire. He sat on a weak bench for several minutes for the tire to be replaced.
Having the flat tire between JFC and this place was a clear indication that the gods want you to listen to something. Among all the vehicles, it was his vehicle that had a problem. And that surely speaks loud of the gods of the land, that indeed fix these roads for these people. My people are crying. Help fix the roads for them.
Roads in the Sisala area remains the worst in the Upper West region, despite the enclave not only being a farming hub, but the food basket of the region as well. To add insult to injury, was cut off from a European Union 35 million euro, 670 kilometers funded farm access road project. It ruffles some feathers, but the roads and highways, food and agriculture, and Upper West Regional Minister intervened and doused off the social tension in the area.
Because the town lies has elapsed, yet no work has begun. Where there's a fixing contract, where they said the contracts are going to be reviewed and then include us, we have not seen that yet. So in effect, we are saying that the Minister of Roads and Highways, who we have presented a very beautiful smoke to, who we have presented the lives of the Sisala people, and then they straight for him to work for us and work with us all, ensuring that we all grow together and develop this country by fixing our roads, has not been realized, because the heart still remains a custody of the Sisala people and in safe keep, because the heart is safely kept somewhere for the minister to come fix the roads based on his promises, so that the heart will be released to him.
There's the news desk on the JoyNews channel. We'll take a quick break. We'll be back with business. Stay with us.
Hi, welcome to Business. My name is Darryl Kwao. A total of 2,025 liters of illicit petroleum products concealed in yellow jerry cans, popularly known as Kofor gallons, and kept in a commercial vehicle has been impounded at Hamle in the Lambouche district of the Upper West region. A combined team of personnel from Security Intelligence Directorate, Upper West Region Office of the National Petroleum Authority and the Ghana Armed Forces impounded the vehicle loaded with the illicit petroleum products. JoyNews' Upper West Regional Correspondent Rafiq Salam has more for moi.
Communications Manager of the MPA, Mohamed Abdul Kudus, in an exclusive interview with JoyNews, stated that the products, which were kept in 81 jelly cans and valued over 30,000 Ghana cedis, is suspected to be smuggled into the country from neighboring Burkina Faso. The vehicle, with registration number UW113-14, was spotted loaded with unwholesome products plying on approved routes around the Hamle enclave.
Preliminary investigation around the product, where the various standards were measured to see whether the product actually were genuine, or, if you want, a good product for the market. It has failed in all of the tests, which means that the product is of dubious source. My understanding is that it is still in the custody of the military, to whom that particular exercise was carried upon. I must add that the protocol, as it is, normally starts from the region. The region submits the report to the head office, and the determination is made at the head office on the finality of the investigation and subsequent punishment that is supposed to come alongside. My information is that the report has come to the head office and the process has actually been activated. And as and when the determination is made of what to be done with the product and the people responsible for that particular product, we would actually be putting it out to the public.
For some time now, there have been complaints from dealers of petroleum products, especially fuel managers in the Upper West region, of the smuggling of unwholesome petroleum products into the region from neighboring countries.
And let's turn to other news now. The Ministry of Food and Agriculture has partnered Adepa Fertilizer to boost the production of crop in the country. The Department of Agriculture is enthused about the private sector initiative to produce mass organic fertilizers to transform the food and agriculture industry. Love FM's Sanaya Abuache has more in this report.
Farmers at Drobonso in the Seche Afram Plains participated in a field demonstration and training in the adoption of Adepa fertilizer in crop production. Kojo Educhum, whose company produces Adepa fertilizer, explained how organic fertilizer can be helpful on farm products.
Adepa agro organic pesticide
We decided to begin the production of agro-organic fertilizers when the Folami worms started to take over our farms. We came out with the Adepa fertilizer when it became difficult to access organic fertilizers some time ago. At the moment, it's been able to help our farmers and to support government's Planting for Food and Jobs initiative.
Organic liquid fertilizer and so there aba ejaso se kwani bia no oba ebetimi aboa no ne sebe ya ban ni so de won aye Planting for Food and Jobs no enye kwa.
The Ashanti Regional Director of Agriculture, Reverend John Menu, described a global shortage in the supply of inorganic fertilizer, resulting in soaring prices. He is confident the locally produced fertilizer will ease supply on farmers and help sustain food production.
We are not relying only on Adepa. We have the Kumasi compost recycling company that is also coming out of compost that is packaged to support, because really we need a lot of volumes as far as organic fertilizers are concerned, because we are patronizing foreign products. You know, it was also competing with the farmers produce over here.
And that's Business. Sports is coming up next, to stay tuned.
Welcome back. Time for us to bring you sports, and my friend Karim is here. Karim, how are you?
I'm doing great. Yourself?
I'm good. What are we talking about today?
We're talking about how Argentina were received on their arrival back home. They were crowned world champions in Qatar on Sunday. If you see how they were received, you know what football means to the Argentinian people. They were welcomed back to Buenos Aires around dawn 2 to 3 a.m. The number of people that have welcomed them, when you see how the crowd jubilated, you know how they fought for the title, what it means to the people. They were welcomed on an open bus on the streets of Buenos Aires, and amid the jubilations, you could see the emotions in the faces of the Argentinian people. They were really overwhelmed about what they've seen Messi and his teammates do in Qatar to bring back the title.
That's something they've been waiting for how many years? After Maradona
36 years.
Good. So it's something they were really
waiting for.
I mean, the videos of it, incredible scenes. These are scenes I would love to see one in Accra.
Wow.
Tamale.
We don't know how long it will take Ghana to do this, but certainly not anytime soon.
Anyway,
yeah,
but the Moroccan coach is saying that an African country can win
in 10 to 15 years.
Yeah, so
he's dreaming, and it is what has paid them to do what they've done in Qatar. Being the first African team to reach the semi-finals of the World Cup is something incredible they can be extremely proud of.
Okay.
And amid the jubilations, we've seen the Argentinians doing. They nearly got overhung by some wires hanging on the streets. They were jubilating, but fortunately, they were able to get past that, and still, they are still on the jubilations as we talk.
Oh, they are still there as we...
The parade, the jubilation parade is still ongoing in Buenos Aires as we talk.
My only hurt in this whole win is Lionel Messi winning, but yeah, it's fine. He's
you
a fantastic footballer. So
you hurt more in the coming days. He's breaking records on and off the field.
No problem.
Just as we talk, his post about the World Cup, them winning the World Cup, has now become the most liked on Instagram. He's overtaking. He's overtaking the egg, the record egg from
And that's how we wrap up our sports. There's more on myjoyonline.com. My name is Samuel Kojo. Do enjoy the rest of our programs. Have a good morning.